Hello everyone, my name is Ni Nguyen. Today I'm going to talk about a post-traumatic stress disorder, PTSD, in military. Many older veterans find they have PTSD symptoms even 50 or more years after their wartime experience. So what is PTSD? During a potentially traumatizing event, our brains take a snapshot of that situation and remember the circumstances. In similar circumstances, our bodies react with a fight-or-flight response in preparation to deal with the threat again, which may be adaptive in life-threatening situations. PTSD leads a person to overgeneralize the fight-or-flight response to threats. People with PTSD may continue to respond to triggers as if their life is in danger, even when it is not. Around 6 to 7% of Americans will experience PTSD at some point during their lifetime. However, this rate is much higher for veterans, and the exact amount depends largely on which conflict they endured. The number of veterans with PTSD varies by service era. About 11 to 20% of veterans who served in OIF and OEF have PTSD in a given year. About 12 out of every 100 Gulf War veterans have PTSD, and about 15 out of every 100 Vietnam veterans were diagnosed with PTSD. Other factors in a combat situation can add more stress to an already stressful situation. This may contribute to PTSD and other mental health problems. These factors include what you do in the war, the politics around the war, where the war is fought, and the type of enemy you face. So what is like for veterans who are living with PTSD? Individuals suffering from PTSD often have flashbacks of the traumatic events, bad dreams, and other threatening thoughts. They may also develop avoidance symptoms, whereby they purposely stay away from anything that reminds them of the experience. This can mean avoiding certain places and objects that serve as a reminder of what they've experienced. Trouble sleeping is also common with PTSD. According to the National Sleep Foundation, this is usually due to the individual feeling like they need to be alert, which is a result of the anxiety that sometimes comes with the nightmare and subsequent darkness, or the nightmares the person seeks to avoid. Veterans with PTSD may notice cognitive and mood changes as well. For instance, they may find it difficult to remember the entire traumatic event or feel guilt associated with their part in it. Sometimes they have negative feelings toward themselves or the world at large, or they lose interest in activities they used to enjoy. Why do some military personnel develop PTSD where others don't, even if they witness the exact same event? Being exposed to troubling life experiences prior to joining the military can increase the risk of PTSD, partially because the event's negative impact creates other psychological issues. Another risk factor is if a service member witnesses an injury or death or discharges his or her weapon during active duty. There is a higher risk of developing PTSD than a service member who has not experienced these circumstances. Female veterans develop PTSD more often than male, possibly due to reasons associated with being more susceptible to depression, experience less cohesion in the military unit, and being more sensitive to threats. The lower educational level, the higher risk of PTSD, potentially due to not having learned effective coping skills or limited access to helpful resources. The main treatments for people with PTSD are medications, psychotherapy, or both. The medication for treating PTSD are antidepressants, which may help control PTSD symptoms such as sadness, worry, anger, and feeling numb inside. Other medications may be helpful for treating specific PTSD symptoms such as sleep problems and nightmares. Psychotherapy or talk therapy involves talking with a mental health professional to treat a mental illness. Psychotherapy can occur one-on-one or in a group. Talk therapy treatment for PTSD usually lasts 6 to 12 weeks, but it can last longer. In addition to PTSD therapy, there are ways veterans can cope with PTSD. Adopting a dog may help veterans get relief from their symptoms. K9s for Warriors is an organization that pairs service dogs with veterans suffering from PTSD and other debilitating effects of war. It was founded in 2011. The organization's goal is to give a new leash on life to rescue dogs and military heroes, empowering warriors to return to civilian life with dignity and independence. Thank you so much for listening. I hope you enjoy it.